Hello and welcome. Today, we're diving into a complex and often misunderstood neurological disorder, Lewy body dementia, or LBD. We'll explore what it is, what causes it, and how it affects individuals and their families. Understanding LBD is crucial for better diagnosis, care, and ultimately, finding a cure. The exact cause of Lewy body dementia remains a mystery, but we know it's linked to the abnormal buildup of alpha-synuclein protein inside brain cells. This protein clumps together, forming structures called Lewy bodies. While the presence of Lewy bodies is a hallmark of the disease, scientists are still working to understand why these proteins misfold and accumulate in the first place. Genetic factors play a role in some cases, but most instances of LBD appear to occur sporadically, meaning they arise without a clear family history. At the heart of Lewy body dementia is the disruption of normal brain function caused by Lewy bodies. These abnormal protein deposits primarily affect areas involved in thinking, movement, behavior, and mood. Specifically, Lewy bodies damage neurons that produce important neurotransmitters like dopamine and acetylcholine. Dopamine deficiency contributes to the motor symptoms similar to Parkinson's disease, while acetylcholine deficits affect cognitive function, leading to fluctuations in alertness and attention. The accumulation of Lewy bodies also triggers inflammation and oxidative stress within the brain, further damaging neurons and disrupting neural networks. Lewy body dementia is estimated to affect over 1 million individuals in the United States, making it the second most common type of progressive dementia after Alzheimer's disease. It typically affects individuals over the age of 50, with the risk increasing with age. Men are slightly more likely to develop LBD than women. Due to overlapping symptoms with other conditions like Alzheimer's and Parkinson's, LBD is often underdiagnosed or misdiagnosed, making it difficult to accurately determine its true prevalence. Lewy body dementia presents with a wide range of symptoms that can fluctuate significantly from day to day, or even hour to hour. Core symptoms include visual hallucinations, which are typically detailed and realistic, Parkinsonism, which involves movement problems like rigidity, slow movement, and tremors, cognitive fluctuations, characterized by unpredictable changes in alertness and attention, and REM sleep behavior disorder, where individuals act out their dreams. Other common symptoms include depression, anxiety, apathy, sleep disturbances, and problems with autonomic functions like blood pressure and bowel control. Diagnosing Lewy body dementia can be challenging because its symptoms overlap with other conditions. A comprehensive evaluation is crucial and typically involves a detailed medical history, a neurological examination, cognitive testing to assess memory and thinking skills, and neuropsychiatric assessments to evaluate mood and behavior. Brain imaging techniques, such as MRI or CT scans, can help rule out other conditions. A DAT scan, which measures dopamine transporter activity in the brain, can help differentiate LBD from Alzheimer's disease. In some cases, a skin biopsy to look for alpha-synuclein deposits may be considered. Ultimately, a diagnosis is based on a combination of clinical findings and diagnostic test results. While there isn't a single official classification, Lewy body dementia is often divided into two related conditions: dementia with Lewy bodies, DLB, and Parkinson's disease dementia, PDD. The distinction is primarily based on the timing of cognitive and motor symptoms. In DLB, cognitive symptoms typically appear before or concurrently with motor symptoms. In PDD, motor symptoms of Parkinson's disease precede cognitive decline by at least 1 year. Both DLB and PDD share the same underlying pathology of Lewy bodies in the brain. Currently, there is no cure for Lewy body dementia, so treatment focuses on managing symptoms and improving quality of life. Medications can be used to address specific symptoms. Cholinesterase inhibitors, which are also used in Alzheimer's disease, can help improve cognitive function. Medications for Parkinson's disease, like levodopa, can help with motor symptoms. Antidepressants can be used to treat depression and anxiety. It's crucial to work closely with a healthcare team that includes neurologists, psychiatrists, and other specialists to develop an individualized treatment plan. Non-pharmacological interventions, such as physical therapy, occupational therapy, speech therapy, and support groups, are also important components of care. Unfortunately, there are no proven strategies to prevent Lewy body dementia. However, adopting a healthy lifestyle that includes regular exercise, a balanced diet, and engaging in mentally stimulating activities may help promote overall brain health and potentially reduce the risk of developing neurodegenerative diseases. Further research is needed to identify specific risk factors and develop effective prevention strategies. Lewy body dementia is a progressive disorder, and the prognosis varies depending on the individual. On average, individuals with LBD live for 5 to 8 years after diagnosis, but this can range from 2 to 20 years. The rate of progression can also vary significantly. Recent research is focused on developing new diagnostic tools to detect LBD earlier and more accurately. Clinical trials are underway to test potential therapies that target alpha-synuclein aggregation and neuroinflammation. Scientists are also exploring the role of genetics and environmental factors in the development of LBD. While there's still much to learn, ongoing research offers hope for improved treatments and ultimately, a cure for this devastating disease.